requirements on that money is that we don't change the eligibility for Medicaid. I wouldn't expect your caucus to be interested in that, but has it come up? We're cranking down on eligibility, making it more, I think the approach in 2002 was to say only the very neediest people should be able to get the state assistance. My understanding now is if you change the eligibility rules, you will lose some of that.
I don't think we would have been headed in that direction anyway.
Yeah. Why not? I mean, that was
These
effective in reducing spending.
these are not, I mean, these are low income families with their only option for health care. I mean, you just, there are already, in my opinion, there's already too much proposed in the current budget cuts that causes people to lose health care coverage, like the DHP cuts and so forth. So that would be in GAU. That would be exacerbated if you were to go after Medicaid as well. Plus, it's a federal match of I think it's still 50-50, although this FMAP number might make the match even more attractive for us. We might even get a little bit more, I believe, of a match. And so, you lose the option of utilizing federal dollars to help people get health care.
What about for kids? I mean, there you're going up to a much higher income range to give health insurance to kids.
And the S-CHIP bill that was passed at the federal level supports that income level. So again, you have federal dollars you can bring into Washington State and provide health care for children, and we just have to step up and do our part as a state. And health care for children is relatively inexpensive. Not providing health care for children just causes you all kinds of problems down the road. And similarly with Medicaid, you take away that official health care coverage, that doesn't mean people's health care issues go away. That means they go to emergency rooms and that their health care costs get transferred into the rest of the system.
Do you have any hope of being able to supplant some of the dollars that the state's putting into Medicaid and find some extra money that can be moved out of that FMAP? Obviously, the FMAP money the feds give has to go for Medicaid, but as I understand, they'll match at a higher level than the state's paying now. So some of the money the state's paying for the existing caseloads, the state can put less in. So you have some savings to move elsewhere. Do you see that being used for anything?
Healthcare services in a variety of state programs, whether it's developmental disabilities or mental health or DHP, I mean, there's plenty of healthcare options for utilizing those dollars. So I don't know if we plan to divert those.
Okay. All right.
How much are you looking at tax exemptions at this point?
I know that over the last few years there have been lists compiled. I mean, I don't know that anybody's, I'm sure some people are looking at them. It's not where our attention is focused right now.
I mean, is the order looking at cuts and then maybe exemptions and then maybe revenue increases? I mean, what's...
Well, I think, as I said before, we would be looking at them, frankly, more closely if it didn't require a 2/3 vote or a vote of the people, which, or exemptions, to just to maybe modify them or temporarily suspend them, because there are many tax exemptions that are useful for a variety of purposes, but you could argue, just like we're suspending some mandates and suspending some expenditure programs, you could suspend some tax break programs temporarily, but under 960 we're not really allowed to do that the same way we can do these other things.
The other things being?
Cut programs, we can do that with simple majority.
But isn't that untenable? I mean,
rules.
In the grand, I mean, from what you said earlier today, that idea of an all-cuts budget is just not something that sounds...
Yeah, I guess what I'm saying is that there's a lot of tax exemptions, but there's a certain lack of ability to, if we could just incorporate that the same way we do other pieces of legislation, there would be more of an impact. Knowing that you have to essentially refer it to the public makes it a lot. I mean, how many things would you want to put out for the public? 50 tiny tax breaks? I don't think we would be headed in that direction. Doesn't seem like an efficient way to close the budget gap.
How many things do you think the public could vote on reasonably? I mean, that's 3, 4? I mean, is there some number?
Well, there's always citizens initiatives that come forward, so we don't have any control of how many things they end up voting on. I don't think the legislature would send out more than 1 or 2.
Unemployment insurance, there is that bill, Senator Hargrove's bill, chatted about when the unemployment benefit bill was signed into law. At the time, they did defer some of the money out of the trust fund and away from that $45 payment into worker training. It's my impression at the time the bill was signed that it was going to be amended so you didn't take away from the 45 and you were going to find another piece of the trust fund to fund the worker training. Where is it now? I mean, right now it's still taking out of that $45 payment. So what's the plan with that?
I don't think that there's a plan, but Senator Hargrove's bill has been modified over time. If that bill moves forward like it is now, it would essentially not cost the trust fund anything because it would come out of a diversion of some of the funds the state was putting into increased benefits. And then the Fed's also putting more money into increased benefits. So workers would still get increased benefits, even more than the state amount, but maybe not the total of state plus federal.
I guess that's my question. The governor signed a law, talked a lot about $45. That bill would turn it into $31. I know there's Fed money on top of it. I was under the impression you guys weren't going to do that, but if you do go with it, that 45 won't be able to get out by May.
Well, I'm not sure those numbers are exactly correct.
Want me to go through the timeline? The federal bill would go into effect January 1st, it's $25. The state amount would go into effect in June. The way the benefits bill is they're stacked. So if the state didn't divert some of that into the training program, they get 70, but instead they'll get 59, right? So what will happen is they'll get federal benefits at 25 until May 3rd. And on May 3rd, it'll bump up to 59. Does that make sense?
They get a lump sum in May, because ESD doesn't have the capacity, or they haven't figured out their computer system yet.
That'll take them till May, but they'll get the federal 25, the state money will come in May, get them to 59. They would have gotten 70, but we want to take some of that money and retrain people who've lost their jobs into fields where there are vacancies, like healthcare, where there are 12,000 vacancies.
I guess that's where my question comes in. Is the governor on board with actually giving less than she signed a law to give them?
Wait, you'd have to ask her that.
Are you guys ready to move it off the floor? Do you have the votes to basically reduce the very benefit that utilities?
Well, I think that's an odd way to put it, since we actually increase the benefits going to workers.
I'm thinking Olympia.
And they're going to increase even more. So I think it's an odd way to say that we're reducing benefits when we just increase them. I mean, ironically, I just heard the governor that doesn't want to take the federal stimulus money, he said there were strings attached, and they said, well, what strings attached? And he said, well, our UI trust fund is bankrupt, and so we're getting a loan, but if we take the loan, we have to increase UI benefits. And I thought, wow, I mean, gee, that's rough.
So
Too bad for those.
Let me ask my way this way. The law in Washington today calls for a $45 benefit increase paid by the state for every unemployed person starting May 3rd.
That we just passed.
Right, and Senator Hargrove's bill would essentially amend that to make it a $31 increase, right? Am I understanding what the effect of that
We
would be?
got a $25.
If
I
you just
understand the
got,
federal, but just the state portion of the benefit.
nobody's going to get anything taken away from them. They're getting an increase in their unemployment benefits. And we have one of the healthiest UI trust funds in the country, and we're in a recession. And if we can temporarily, for 2 years, put some of this into training in 3 specific areas: healthcare, aerospace, and green jobs, building trades, then that will help unemployed workers get jobs, which I think is a very positive thing for those unemployed workers, as is the increased benefits we just passed.
So they wouldn't have to pay for the
And
training?
my understanding is that the labor community is on board with this. I just spoke with Rick Bender of the Labor Council, and he said, we're on board with the training bill.